Hi, my name is Morgan Eutermoser, and I will be presenting the abstract, The Impact of Real-Time Second-Level Physician Triage at a Nurse Advice Call Center. The authors are as you see them. We all work at Denver Health Emergency Department and have no financial disclosures. In 1997, Denver Health, a safety net hospital with an emergency department volume of more than 120,000 patients per year, started an advice nurse line to answer patient questions and triage their symptoms using the well-established Schmidt and Thompson call center guidelines. When patients call the nurse line, they're triaged by a registered nurse who uses algorithms to determine a recommended outcome. These outcomes can range from call 911 to recommendations for home care. In 2014, Denver Health added real-time second-level physician triage during peak hours to the nurse line in an effort to meet expanding needs of patients, deliver timely and cost-effective patient care, and reduce the burden of ED utilization. During a call, if a nurse obtains an outcome of 911, ED, 4-hour, or 24-hour evaluation, then they consult a board-certified emergency medicine physician for real-time review. The physician can upgrade, downgrade, or maintain the outcome communicated to the patient at the end of the call. The objectives of this study were to estimate the impact of second-level physician triage at a nurse call center on triage outcomes and to determine if second-level physician triage can result in a measurable cost avoidance to the overall hospital system. We performed a retrospective observational study for the purpose of quality improvement. We included all patients January 1st, 2018 through December 31st, 2018, Monday through Friday, during the hours of 12 to 10 p.m. Data was analyzed using SAS enterprise software, and descriptive statistics were reported as proportions with 95% confidence intervals. In 2018, Denver Health Nurse Line took approximately 46,000 calls. 16,000 of these calls occurred during the hours of a physician. Almost 6,000 calls resulted in a physician consult. And this is where the data gets a lot more interesting. So, of the calls that were deemed appropriate for 911, 68% of these calls were downgraded by an emergency medicine physician. And of the calls that were instructed to go to the emergency department by the algorithm, 47% of these were downgraded to a lower level of care. 911 and ED calls that were downgraded to home care equaled 10% of the calls. The cost savings estimated for 2018 for the addition of a second-level physician triage totaled close to $1 million based off financial estimates from the organization. In conclusion, use of ED physicians as second-level physician triage at our nurse advice call center had significant impact on resource utilization within our healthcare system, resulting in a measurable cost avoidance. By adding second-level physician triage to a nurse advice call centers, hospitals can decrease unnecessary ED visits by triaging patients to more patient-centered, appropriate levels of care compared to algorithmic triage systems.